10:16 for your Sunday. Many of us have had or have faced a time of great trauma in our lives. Maybe you were in a serious car accident, or perhaps you were a victim of a violent crime. Well, now imagine having to deal with that multiple times a day. That's what our first responders do for a living. Last month, 2 Houston police officers took their own lives, highlighting the increasing need for mental health support for our police, fire, and other first responders. In today's cover story, Matt Stone looks at what's available locally.
Words can't even begin to describe this horrific scene in Youngstown from 2018. 5 children perished in a fire one cold December night. Their ages, 9, 3, 2, and 1-year-old twins. Just hearing the news can bring tears to your eyes. But what about the men and women who must respond to these tragedies?
When you see other people who, are concerned about their loved one, you see death a lot, people, dying on you, or you get there and they've already been passed. So, those are the things that you see, just about every shift. And so you can imagine that.
Mike Smith is an Austintown firefighter. He is also a trainer for the Critical Incident Stress Management Team in Mahoning and Trumbull counties. The team is called CISM for short.
Usually with first responders, it's not that first time, it's that buildup over years that happen, and then there's just one thing that kind of triggers it, and that's when they need the help.
Our first responders are not robots. They have emotions. They have families that they go home to.
911 was your emergency.
New reports of multiple people trapped in the basement. Rescued one, we're working on a second.
We got civilians over here screaming for help. I can see them.
You hold this leg, I gotta get down there.
CISM allows first responders to meet and talk to peers about the traumatic events they have all experienced.
Drop the gun!
It normalizes the process and lets them know it's okay if something bothers them or if they are struggling after a certain event.
Getting together with other peers and talking to other peers who have also gone through that process, that's very powerful. It helps an individual to feel like, okay, this is okay that I'm experiencing this right now, and I'm going to be okay, and I can get back to work.
Anybody can reach out to the Mahoning County Mental Health and Recovery Board or the Trumbull County Mental Health and Recovery Board, or they can contact 211 and request to talk to somebody from the CISM team, and then we would work with them to figure out what their needs are, whether they needed to speak with a peer, a mental health professional, or if we needed to refer them to one of our agencies that is experienced in working with first responders.
626. Shut it up. Where my hip?
Stop, hop on, I got you.
Where am I going? Give me somewhere. Hospital.
I got you.
Am I dying?
No, stay in there, I'll take
If your spouse or significant other is a first responder and you can tell they are struggling and they show changes in sleep, appetite, or mood, encourage them to contact the CISM team. With today's cover story, I'm Matt Stone.